Hi, my name is Deirdre and I'm the lead skin oncology clinical nurse specialist here in oncology.
Hi, my name's Mark. I'm skin oncology support worker.
So in June I was invited to speak about one of our skin oncology melanoma patients at UK Oncology Forum conference, and I was talking about one of these newer combined immunotherapy drugs, and I wanted to bring Myrna's story to life and to bring it back to a patient and how it has impacted her for the best and improved her quality of life. Because Myrna had a really tough time at the beginning and difficulty with walking and her mobility due to the melanoma, and herself and her husband Colin, they really liked going out walking, and that was something that really touched me, and I was really quite concerned, and I went to Dr. Ratnayaka about my concerns and tried lots of different things that didn't help Myrna. But then after a while and after a few more cycles of treatment, Myrna started to improve. She stopped using analgesia and she was walking the Hoe and Dartmoor, and that's the whole reason why we do this job.
My name is Myrna Donovan and I'm 82 years old. Well, 6 years ago I was diagnosed with a melanoma on my leg, and after about 5 operations it sort of came back, and the last one was the really bad one. So then I was advised to go on immunotherapy, which is actually helping the condition. When I was in pain, Colin, that's my husband, took over most things, you know, everything, putting the washing out and God knows what else, and ironing. But now it's back to normal for me, so that's the main thing. There's nothing that I cannot do in that respect. It's brilliant because, I mean, we've always been walkers. We walk miles, we walk on the moors, and when I go up to Reddington, my son, we do massive walks, and it's just lovely to get back into the state that we were in, able to do the walking all the time.
Hi, my name is Dr. Gihan Ratnayak. I'm one of the medical oncologists here in Derriford, and I treat melanoma patients. I wanted to talk a little bit today about the patients, our melanoma patients who are receiving treatment with a type of treatment called immunotherapy, which is a type of drug that helps stimulate the immune system to get the immune system to start to attack cancer cells. That's been something that's been shown to change the outcome for a lot of our patients, and as you've already heard, one of our patients, Myrna, has derived quite significant benefit from having this treatment, helped control her symptoms that she was getting from her cancer by treating the cancer and actually improving her quality of life.
So just thinking back to why we all do this job and the sense of pride and knowing how Myrna has responded, but how other patients respond, the sense of pride is always going to be there, and proud to work for UHP bringing this drug here and supporting our patients is very important. But it's also about why we do this job. We want our patients to live a normal life as possible, but with a really good quality of life. That's what we all do in oncology, is to ensure that takes place.
Yeah, I mean, you know, like being able to give anybody their mobility back and letting them enjoy the things that they enjoy doing, that's why we're here.
Well, it's obviously to move on is the best thing ever. And, you know, the immunotherapy, if it works for everybody like it does me, then you're grateful for everything that's being done. I'm happy that I'm in my own skin now and thinking that I'm more normal than what I was before. So that's the main thing, and just nice to get out and about like I usually did.